Hi everybody. I did my presentation on childhood apraxia of speech and autism. And I am Kristen Sakis. So what is childhood apraxia of speech? We can also call it CAS. This is a motor speech disorder where a child has trouble producing sounds, syllables, and words. They're really unintelligible, so it's really hard to understand what these kiddos are trying to say sometimes. It doesn't have anything to do with muscle weakness or paralysis. It's really just their brain can't really talk to their articulators, where they're having trouble moving their mouth, their jaw, their tongue, their lips to produce their sounds or words, and it's really just due to poor motor planning. It's really something that they have to be trained to do. Some symptoms of it, or some red flags for CAS, could be the child isn't cooing or babbling as a baby. They also can have later first words or missing sounds. They are having trouble putting words together. I've seen this a lot with kids that I've worked with, where they are having trouble with producing their consonants and blending it with their vowels, or their vowels are very distorted and just what they're trying to say doesn't sound like how other kids are trying to say those words that might be typically developing. They might also have long pauses between sounds as well. That's another part of the motor planning, where they're really thinking about trying to say that certain sound. They're really trying to produce it with their articulators. It's just harder to do. They also might substitute difficult sounds with easier sounds, or they might even omit the difficult sound altogether. They also might be oversensitive or undersensitive in their mouths, and that could potentially cause feeding problems as well. So those are things that we have to look out for, and those might be some good questions that we can ask the parents of the kids when we're evaluating them, to really see all the services that they might need. Here's some more characteristics of CAS. They make inconsistent errors with the same speech sound. So when they say a word one way, it might not sound the same another time that they try to say that word, which makes it really hard to try and predict patterns of, like we can really do with phonological errors, where they're always using the same substitution for a sound. It's harder to really predict what they're saying or understand what they're saying, just because it's so inconsistent. And with this, these kids know what they're wanting to say. Their receptive language is great typically. It's just their expressive language. It's really hard to get out what they want to say due to that poor motor planning. And with that, it's hard for these children to imitate sounds. Long words and sentences are really hard to produce for them. Along with these errors in their speech sounds, prosody is really hard for them. So their tone of voice changing with their inflection and everything else, that's really hard for them to imitate or even come up with on their own. And along with the CAS, with this, it's really hard for the kids to learn how to read and write, which makes a lot of sense if they're having trouble with producing these sounds themselves to speak them, and it'll be harder to decode them while they're trying to read and write and spell. So diagnosing childhood apraxia of speech, this can be difficult, and there's not a ton of data on it. But the first step would be to go to an audiologist for a hearing test, because a lot of times we see kiddos that haven't had a hearing test, and that could be a huge indicator of why they're not producing their sounds correctly. Maybe they can't hear them correctly, and that's what we need to address first. So we need to rule that out before going to the next step, which would be being evaluated by a speech language pathologist. And the SLP will conduct a oral motor skill assessment and test the melody of speech, which is the prosody, which we were talking about earlier. Finally, The SLP will check to see if the child knows how to stress syllables within words and sentences. Again, that can be like the inflection, how the child can just change their voice from going up and down, how to do a sentence where they're asking a question and they change that inflection at the end of the sentence. So treatment for CAS, these kids would benefit from receiving individual speech sessions 3 to 5 times per week. They're typically not the best candidate for group sessions. These kiddos need a lot of one-on-one attention. They really need visual, auditory, and tactile cues. So using a mirror with these kids so they can see how their mouths are moving and how their tongues are moving, that can be really helpful for these kiddos to help learn how to do their speech sounds. The auditory aspect of it, it's us telling them how to move their tongue or how to put their lips, those kinds of things. We can use tactile cues where the child puts their finger on their chin when they're opening their mouth, going ah, kind of giving them that cue to do that ah sound. That could be helpful for them as well. Also, some of these kiddos, since they are so unintelligible, they might use sign language or a communication device. That might be easier for people around them that aren't really familiar with CAS and not familiar with them. Might be easier for people to understand them. Also, when we're starting these treatments with the kids, simultaneous productions, so when the speech therapist and the child are saying the word at the same time, we start with that because they have to watch how our mouths are moving and copy us as we're doing it to try and mimic what our mouths are doing. We'll try to increase that to direct imitation to where the speech therapist would say the target word and then the child would say the target word. We would hope to get to that point. But we definitely do want to start with simultaneous productions. And this is the most important thing, is practicing at home. I really stress this to the parents that I see when they ask me, how long is this going to take? How long is my kid going to be in therapy? And I really stress to them, practicing at home and really making it part of your daily routine is going to be the biggest thing for you guys. So making sure we're stressing to the families, hey, we need you to practice this with your kiddos. You can try to incorporate it in part of their day to where it's not really adding something else. It could be while you're reading a book, you practice some of the words in there, or while you're brushing your teeth, you practice some speech sounds because you're already in the mirror. Things like that to where our families aren't feeling overwhelmed with adding another thing to their day when we know that they're already so busy. Now, in relation to autism, autism and CAS are actually really closely related. Researchers believe that if a child has one of these diagnoses, they should be evaluated for the other. According to the team at LME, 63.6% of children with autism have childhood apraxia of speech. So that's actually a pretty big portion of them. Now, there is a spectrum of childhood apraxia of speech. Like autism, they have their spectrum as well for that diagnosis. So the children with CAS can distort sound, especially the vowel sounds. I've seen a lot of kids, the vowels, they sound different every time. It's harder for them to really motor plan how to put their tongue, how to move their lips, how to shape their mouth to make that correct sound. Again, those inconsistent speech errors, some of them might have groping, which is where they're moving their mouth and they are trying to get that sound to come out and they just can't quite get it. So they're just really playing around with their mouth trying to get that correct, their articulators to get in the correct position. And others might have errors in rhythm, stress, and tone, which can go hand in hand with prosody or intonation. So what about diversity? How does that tie into all of this? So according to a research study that I saw, African American and Latino children are less likely to be diagnosed with the autism spectrum disorder. This could be due to some cultures are not willing to seek help from medical professionals to get a diagnosis for their child's developmental delays in behavior. Sometimes it's just some cultures believe that, the kids are how they are, or they don't believe in diagnoses. Just really depends on the family. So we really got to think about that while we're treating these kids and evaluating these kids as well. So there's different views that people might have. So Puerto Rican, African American, and European American mothers, they have different beliefs about the importance or the order of the developmental milestones that are being reached. So some might think that some different milestones might come earlier, or some might not really matter to some of the other cultures. There's also a study that showed that African American, Asian, or Pacific Islander and Latino parents are less likely to view emotional or behavioral problems as atypical, and they really don't want medical professionals to put a label on their children, which I see that a lot in my field or in my place of work, where they just don't want that diagnosis. They don't want to put that on their child, which I totally understand. I really get that. There are also some support groups that you can find on the websites. You can look those up, and they have a lot of different resources, which is so important to find a support group, especially if you're not sure how to navigate a diagnosis and you're new to it, you want to learn more, or just have people by your side that have gone through the same thing. So those are always really helpful to have for our families. Those are my references, and that is the end of my presentation. I hope you guys enjoyed it. I hope you guys have a great day.